What skincare is needed after a biopsy? After having a skin biopsy, many people wonder about the best way to care for their skin to ensure proper healing. It's important to follow specific steps to promote healing, reduce scarring, and prevent infection. Let's break down the essential skin care needed after a biopsy. First, keep the initial dressing or bandage on for about 24 hours. This protects the site and keeps it dry. After removing the dressing, you can shower and gently wash the area with a mild, fragrance-free soap. Brands like Dove, Cetaphil, or Purpose work well. Remember to avoid scrubbing. Just use your fingertips gently and pat the area dry. If your biopsy was on the scalp, you can carefully use shampoo. Next, moisturizing the wound is crucial. Apply a thin layer of petroleum jelly, such as Vaseline or Aquaphor, from a new tube. Keeping the wound moist helps it heal faster and reduces scab formation, which can minimize scarring. Reapply the ointment 4 to 5 times a day or whenever the area looks dry. After applying the ointment, cover the site with a clean adhesive bandage or nonstick gauze and tape. This protects the area, especially if clothing might irritate it. If the biopsy site is in a location that is less likely to be disturbed, it may be left uncovered as long as it remains moist with ointment. Be sure to change the dressing and clean the wound 2 to 3 times daily or as directed by your healthcare provider. You should also be mindful of activity restrictions. Avoid strenuous activities, heavy lifting, swimming, hot tubs, or baths for at least 1 to 7 days after the biopsy, depending on your doctor's advice. This helps prevent the wound from reopening or becoming infected. Monitoring for complications is another important step. Keep an eye out for signs of infection, such as increased redness, swelling, pain, warmth, yellow or foul-smelling discharge, or fever. If you experience bleeding, apply from pressure for 10 to 20 minutes. If the bleeding does not stop, seek medical advice promptly. Always contact your healthcare provider if you notice signs of infection or if the wound does not seem to be healing properly. For long-term care, continue your wound care routine until the biopsy site is fully healed, which may take about 10 days or longer, depending on the type and location of the biopsy. Once healed, protect the area from sun exposure by applying sunscreen and avoiding direct sunlight. This helps reduce the risk of scarring and discoloration. If your biopsy involved sutures, be sure to follow your doctor's instructions regarding suture care and removal. Some sutures dissolve on their own, while others need to be removed in the office. In summary, after a skin biopsy, focus on keeping the wound clean, moist, and protected. Avoid activities that could disrupt healing, monitor for infection, and practice sun protection once the area has healed. These steps are vital for supporting healthy skin recovery and play an important role in the context of skin cancer diagnosis and management. Always follow the personalized instructions provided by your healthcare professional for the best results.